I'm actually applying everything I've ever learned about the environment now to the outcome autism. When we talk about the epidemiology of autism, this is usually the curve you would think about. And that was published by my esteemed colleague, Dr. Irva Hertz-Picciotto, who works with the Mind Institute at UC Davis. She's a wonderful epidemiologist, a great methodologist, and she luckily came to the field of autism not too long ago, and this is one of her graphs where she's trying to figure out whether the rise in the number of cases of autism could be explained by some methodologic issues in epidemiology that we are concerned about. In this case, we would be concerned about that the age of diagnosis is decreasing, so more and more kids are actually diagnosed earlier. There might be differential migration to certain places where services are offered, such as in California. And we might also include milder cases. And we've already heard this morning that there's a wide spectrum of different phenotypes as well as ways of diagnosing. So the big question is usually when you talk to the media, well, is that rise really true, or is that an artifact? And she, in her paper, concluded that part of it could be explained by these changes in diagnostic criteria and earlier diagnosing, but there's a lot left to be explained. And as environmental epidemiologists, her and I, we both tried to explain it with something else that changed in the environment. And we also both prenatal epidemiologists, meaning we have paid attention to prenatal life for the last 20 years. I actually did a lot of research on adverse birth outcomes, including malformations before. So what we see here in these graphs is that we went from 4 cases per 10,000 births in 1991 to now 113 per 10,000 in 2008. That's quite a lot to account for and to explain. When we go, this is a little graph that one of my students made. When we go to link the birth certificates of California, and specifically the ones in LA, with the DDS, the office that provides developmental services to autistic children, this is the graph of the crude rates you see. So you see that it went from 1995 from 20 to more than 80 in 2004, and it's rising. And you could say, well, maybe people are just getting more service. So what causes autism? You all will hear from Dan. Of course, there are genes, and of course, we know there's a genetic component that is very strong, actually. But there might also be something called gene-environment interactions, and that's an area I'm really interested in, because what it allows you to do is find out who the more susceptible populations are that could actually be affected by an environmental factor. So you all know that cancer causes lung cancer, and the risk ratio is really high, up to 10-fold for a heavy smoker. Nevertheless, 90% of all smokers never get lung cancer, okay? So what do these 90% have that the 10% don't have? And it's probably the same question here for autism. Who are and how can we define these susceptible subpopulations that if we expose them, they will get the disease while everybody else doesn't, or most of everybody else wouldn't? And we have just touched that area of research, and in autism there's just about nothing. Irva just published one paper recently on that. So the risk factors, the so-called environmental risk factors, is everything that's not genes. Well, not to me. For me, it's more the lower part of that table. But definitely where we already know something about the environment is the upper part of this list. So we have looked at obstetric and neonatal factors because those are not that hard to assess. We have records, we have medical records we can go back to, and we have a pretty good way of finding out also the age of the mother. We can find out about diseases of the mother and infections she might have had, as well as medications she had had. When we go to my favorites, which is more in the realm of what I call environmental exposures, air pollution, pesticides, POPs, those are organic pollutants. or something like nutritional deficiencies or immigration and stresses, social stressors, it's very hard to assess. And that's actually where I specialized in, and I'll show you how we do that. So going back to these neonatal factors and obstetric factors, you still need a very good record system. And the best record systems available worldwide are actually in these electronic systems that the Scandinavian countries have maintained for so long. And this is an example of more than 1,000 ASD cases in a Finnish birth cohort. And the Finnish, similar to the Danes and the Norwegians and the Swedes, allow their researchers to link their medical records, electronic medical records, to any vital statistics to do research. And because they allow that to be done, you can have these studies with a lot of cases and very good medical records that you can instantly analyze. And here you can see that emergency urgent cesarean sections increase the risk of autism by about 25%. When it says 1.25, that's a 25% over 1 increase. And when the kid had an APGAR score of less than 7, so it wasn't doing too well right after birth, it had an 80% increase for autism spectrum disease. And when it had to be admitted to a NICU, again, 50% risk increase. So these are clearly indicators for something going wrong during birth. The question, of course, is, was something wrong with the fetus before, or did it all happen during birth? We don't know, but we can start to look at that. Kaiser Permanente in California is another very good source to do these kind of studies, and we have some colleagues who are working very closely with all of the Kaiser databases. Lisa Krohn is one of them at Northern Kaiser. And here you can see what she did in one of her later papers, where she shows that being born early, preterm, and these are the weeks of gestation, between 24 and 37, there's that line going down. Here's again our magic 1, no difference of risk. And you start with a very early preterm birth with a 3 or more fold risk of ending up with an ASD diagnosis in this Kaiser database of almost 2,500 diagnoses. Again, beautiful databases to do this kind of neonatal medical record research in. This is a UK study where they actually looked at drug use during pregnancy, and this is legal drug use. These are epileptic women who took anti-epileptic drugs during pregnancy to suppress seizure. And you can see it was a small cohort of 389 women among 125,000 births in a very long period of time, 20 years. And among these, there were 12 children diagnosed with autism spectrum disease whose mothers also took, most of their mothers took anti-epileptic drugs, and they were able to actually look specifically which ones they took, and it was valproate. And that's the relative risk, which actually was about 18. So you see these huge relative risks, but you see very few children affected. That is common. The less common the exposure, the higher this relative risk. But what often gets reported in the news is this huge relative risk, and it doesn't get tempered by, well, it was very few kids who were affected, because among these almost 400 mothers who took these medications, only about 12 ended up with a child with autism spectrum disease. But we know that now know that during pregnancy you should probably avoid this kind of medication for seizures, and there are probably safer ones. So it's very important studies. Another Finnish study alerted us to the fact that it's also a risk if you had a maternal or paternal diagnosis of any psychiatric disorder. And that here you see for all ASD cases, you have about a 70% to 2-fold risk increase, and it's across all of these types of diagnoses. So we also need to worry about genetic factors that are related to psychiatric diagnoses among the parents when you're doing these kind of studies. So this is what I study. I study air pollution. And I studied air pollution and reproduction for the last 20 years, looking at preterm births, preeclampsia, birth defects. I never looked at autism until a very small grant came along that I got, and one of my students started looking at this. And there are some other studies that have been published, but what I want to show you is they have been published between 2006 and 2013. Ours came out last year. What they did is they used less than 400 cases and a few hundred controls. This, for example, is these two studies are in Dr. Overhitz-Pichotto's charge study from Northern California, and Heather Falk used the LA children in that study. And she showed that living close to a freeway or being exposed to some of these pollutants might increase your risk of autism. However, her risk estimates were so high that I really was concerned about whether I would really believe, having done air pollution studies for 20 years, whether I would believe these results because they were so unbelievably big, the risk increase. So why are we worried about air pollution, especially fine particulate pollution? Well, this is an image that shows you that when we get into that ultra-fine particle range, which is what you're polluted to if you're, what you're exposed to when you're on the freeway or close to a freeway, these very nano-sized particles, they really are nano-sized, meaning they are virus or molecule size. Viruses are known to get into our cells, right? So these ultra-fine particles are extremely capable of going through every barrier we have in our body, including the blood-brain barrier and the placenta, and end up wherever they want inside a cell. And these particles that are like viruses then can take all sorts of pollutants with them on their surface, and they have a lot of surface area because they're so small, and they're very numerous. And that's what I will refer to as traffic-related air pollution. It's these ultrafine particles we are usually very worried about. Traffic is a major source of LA pollution, and you can see here how traffic increased, vehicle miles traveled per capita, and I kept it here at 2005. It keeps going up. This is one of the road networks we used when we were looking at who lives close to what roadway, and you can see the 405 with more than 100,000 vehicles per day. But you can also see that all of the roads in LA are quite trafficked, and you probably know that. So by now. So what we can do is we can measure distance from these roadways and come up with some kind of distance measure. But I actually did something different from that to increase my precision. So first of all, we also need to be able to get records from autistic children, and we get them from all of our centers in LA. And this is just a map of where these centers are that are serving the population in these areas. So we got records from all of these centers that were luckily electronically available to researchers. We got 10,000 of them, and then we're able to link them, geocode them, link them to birth certificates, and then geocode about 7,600 of them. Before I showed you studies with autistic children, 300, 400 cases. So now I'm doing a study with about 7,600 children. And so we have these birth years, 95 to 2006, and the autism diagnosis was usually made 3 years later, up to December 2009. These are my air pollution monitors that I can use to get some of the air pollution measured. But you see, it's like a Swiss cheese. It doesn't cover all of LA very nicely. It gets even worse when I'm interested in air toxics. There are only 4 monitors that specifically monitor toxins that I might be interested in. And then the measurements look kind of like this. Luckily for benzene, it has gone down over time, as you can see. So what I did instead of relying on the Swiss cheese or these few monitors is we built in 2006 a map that looked like this, where we monitored at 200 different places all over the LA basin for 2 weeks in 2 seasons, and then used a lot of data we had available, truck routes, road networks, commercial, residential, industrial data, satellite and satellite data, to build a regression model that gave us this kind of map of where pollution was worse. If you want to know where traffic pollution is, that's the map. And of course, what do you see? I showed you the road map before. You see the roads, right, as you would expect. But you also see that there's a lot of pollution pretty high in the downtown center and along some major corridors. And the west side is doing a little better. So we used this map and then linked this data to the data that I had linked to the birth certificates, and we selected 10 controls also from the birth certificate without any diagnoses. And these are the answers. This is my land use regression modeled estimate for traffic pollution. And here you see 9% increase and highly statistically significant. When I use my Swiss cheese just for fine particle measures, however, I also get an 8% increase. So it is, both of these are showing me that particles are relevant, and they per interquartile range increase, meaning if you're going from the lowest quartile of exposure to the highest, you have a 10% increase in risk in autism. Sounds like not much compared to the 18-fold, right? But this means of all these 8,000 children that we were able to link, 10% might have gotten their disease or might not have gotten it if they hadn't been exposed, right, to the air pollutants in LA. And we also found some signal for ozone, but I don't believe that completely yet. What was even worse is when we split it up by maternal education, less than high school, and more, you can see here the 1.22, that's 22% increase in risk in less than high school educated women for my LUR model, which is that land use map. And only 3% and not statistically significant for mothers that have a higher education. We always believe it's the more highly educated mothers who have more ASD, Asperger kind of children. We still don't know why. But you can see that the low socioeconomic status people are actually much more affected. It might be that they are just living closer to those pollution areas, but it may also be that they are more susceptible, genetically more susceptible, or because of everything else they're exposed to, right? So in this case, 22% increase. So it has high public health relevance because of our traffic increasing, and also the increasing number of children, and this environmental justice issue. So the next question my student asked, well, can I also look at race nativity in LA and see whether there is a difference in that? And there have been studies by the CDC in Europe to indicate that that might be the case, and I'm skipping this. So when you look at crude rates, all I want to show you is that the US-born whites are here, and these are the foreign-born whites, so they come together in 1999 in terms of diagnoses. What's above them are foreign-born blacks, and then everybody else, the Hispanics are below. And the Asians, that's the next one, seem like they go along with the whites. I don't know what this spike is. There are many less Asian babies. But what I'm also telling you is this is crude rates not adjusted for education, age, parity, infant sex, pregnancy complications, birth weight, and insurance. And lo and behold, when we adjust for all of those factors, the picture looks completely different. And this is why we do epidemiology. We need to know what to adjust for. So once we adjust properly for all of this, you can see the picture in Asians looks quite different. Now here are the US-born Asians and the foreign-born Asians, and you could say there's no difference. That's what I showed you actually in the other graph, between Asians and American white infants. However, when you split them up into different origins, you see that Filipinos and Vietnamese mothers have 25 and 43% increases in being diagnosed, their children being diagnosed with autism, while Chinese and Japanese heritage helps you out. Those, and we don't know why. but definitely this is a possible increase in risk we should go after. And the same for Hispanic mothers. Before, you saw that these lines were below the whites, so we are comparing to US-born whites. These are the US-born Hispanics, 13% increase. This is statistically significant because we have so many Hispanic births. And it seems a little less in the foreign-born. However, when you split these up again, you have 26% increase in risk in Central and South Americans. You don't see a difference for the Mexican mothers. And of course, these are the bulk. That's why, you know, it kind of averages it out. But again, what's the difference between the South and Central Americans versus the Mexicans? Very interesting question to ask and possibly answer. It's even worse for blacks. The US-born are 14% increased in risk, have a 14% increase in risk, and the foreign-borns have the highest, and that's what we saw before. So what does that tell us? Well, I just gave you very simple comparisons, but in my mind, what we need to go after are these hypotheses of immigration stress, life events in these mothers who immigrate, depending on where they are coming from. Are they living in neighborhoods with higher environmental exposures? Do they have nutritional deficiencies or get exposed to infections more? Remember those Filipinos that had higher risks? I was really raking my brain, what could that be, until I looked at an employment map for these parents. A large percentage of them work in healthcare. Okay, Filipinos immigrate because they work in healthcare. Maybe it is this that we should be worried about in those mothers. Right? Maybe they need to be immunized earlier before pregnancy. So I think we have a lot to learn from these very simple data, but we need to go after these questions. This is what I do very well. I assess, apart from assessing air pollution, I also know how to assess pesticide exposure in California. I have done that in many studies. Pesticides are ubiquitous. We have them in our diet, in home and gardening, but we also live possibly next to agriculture, and that's what I use to do my studies. And the reason is this little yellow airplane up here that sprays pesticides in the Central Valley, and down there's a home. It's usually a farm, okay? And we have a law, luckily in California since 1972, that requires an applicator to report where he applied, what he applied, how much of it, etc. All of that electronic, all of that I mapped. It took 5 years of students mapping. And now we have for at least 3 counties, but soon for more, these detailed maps of where pesticides were sprayed. These are homes. This is a little community. And I can tell you exactly, if you give me an address, how much pesticide within 500, 1,000 meter circumference was applied. So this is the model I used for Parkinson's disease very, very successfully. We used recently for childhood cancers very, very successfully, and finally got a grant to look at autism. But it'll take us 2 or 3 years to finalize this. So when I come back, maybe I can tell you what we find. I also have a colleague, Dr. Jörn Olsen here, who was my chair, departmental chair for a while, until he went back to direct again the Danish birth cohort. And that's one of those unique resources in the world that we have available to us. And I keep collaborating with him on autism. And why is that so unique? Well, it's a nationwide cohort of women, 100,000 of them, followed since 1996. And these children are now between 13 and 15 on average. And they had done all sorts of pregnancy evaluations, and then also later in life of these children. So the women were enrolled in early gestation, had their first interview, filled out food frequency questionnaires, had lifestyle questionnaires during pregnancy twice, then right after birth, a child's 6 months of age, 18 months of age, 7 years of age. And then what's even more important, Denmark has these compulsory registries, medical registries. So they actually have a national hospital registry for ADHD and autism, and you can find all of the cases in them. So that even if the mothers decide not to report back to the study anymore, which half of them did, you still have a way of finding the children affected. And that's what we did, and we got a small pilot grant from CART, and we're very grateful for that, to start looking at what mothers reported. You saw that nutritional questionnaire there? So they reported what they were eating and what they were using as prenatal vitamins in pregnancy, long before their child may have had autism diagnosed, before the child was even born. So what we were interested in is using these data to see whether we could look at anything that would help us decide whether folic acid might actually be preventive against autism spectrum disease. And the idea was brought to our attention by the Norwegian mother and child cohort, who recently reported a 40% deficit in ASD diagnosis among the folate-using mothers. And then Dr. Hertz-Pichato's study in California also saw a similar kind of association. But those are the only two studies currently that have looked at these kind of connections. So we need to know more about it. This was the California study. And you can see that there was even a dose response slightly reported. So if you had, compared to no folic acid intake at all, you had a decrease of almost 65%, 73%, 75%, 82%. But whether that's really a true dose response, you can see the trend value is not significant. I don't know. And it's based on very few cases. We had 70 here, 82, 33, 121. So these are nice data to have. They look like there's something. If you take folate, it could be protective, but it's based on a very small sample size. Well, we actually went back to the Danish cohort, where about 27% of all mothers reported ever folic acid use, and 48% indicated some kind of multivitamin use. Only 11% reported no use at all. And we were able to adjust for a lot of different exposures, as well as the folic acid use in this cohort. And first of all, you can see that very few use just folic acid. Most of these women, and this is in gestational week, so in the early gestational weeks, every woman is being told to take something. So they usually take these prenatal multivitamins, and they take them until the end of pregnancy, when they kind of stop using them. And that's the typical pattern of use in this cohort. So we related it to the autism spectrum disease diagnoses in the cohort, and we now have about 460 of those cases identified, and we did not see any protective association, at least not one as protective as reported before by the California study and the Norwegian study. However, there started to be a small trend for Asperger diagnoses, but that was a much smaller subgroup. Why is that the case? Well, we actually looked at the literature and found that a previous study found, when they measured folate levels in the serum of women in Denmark who are at reproductive age, they actually were not deficient at all. So maybe taking folate in an environment where your diet is already sufficient won't help you at all, right? That's maybe all this study tells us, but we will definitely look at more explanations. We would like to look also at the nutritional environment and other kinds of explanation for this. What we also can do in the Danish cohort, and we have just started to do, is look at medication use during pregnancy. And while they have a national pharmacy record where you actually get a record of everything the woman was ever prescribed in pregnancy, what that record system doesn't give you is what they took over the counter. But the Danish national birth cohort actually gives you that data. You have because the women were interviewed multiple times, right? And they told the interviewer what kind of medications they've been using. So we, for the first time, can actually get at questions such as Does pain medication, acetaminophen, which 50% of all women take during pregnancy, does that have anything to do with autism? And we are starting to look into those questions as well. We can also ask whether any other maternal diseases, such as diabetes or rheumatoid arthritis, have a relationship to autism, or the medications you are taking for them, and whether anything that happens right around childbirth, of course, could be a risk factor. So the Danish cohort is wonderful to explore all of these questions, and we are looking forward to doing that. There is one other thing we can do with the Danish cohort that few, if not no one else can do, and that's because they sampled blood of the mothers during pregnancy as well, and they stored it away, and they stored plasma or serum as well. So this was one question we had because of recent concerns from animal studies. Perfluorinated compounds in the maternal serum, everybody in this room will be positive for, everybody. Why? Well, they are stain resistant and water resistant Scotchgard agents, okay? And they are highly lipophilic, meaning they like our fatty tissue, and they are easy to be taken up through our skin or with our food or any contaminated surfaces. That's why we all have them, because the National NHANES Health and Nutrition Survey, which also does biomarker checking, finds it in every serum they check. So these are the agents, PFOS and PFOA, and you can see here, this kid is on a surface that is Scotch guarded, so it doesn't matter as much whether, you know, it plays with paint or not. And you can see here from this that the US has some of the highest serum levels next to the poles in the world. Knowing that, you are worried about these kind of data that come from animal models and cell models that tell you that these PFOSs that I just showed to you actually reduce thyroid hormone, they regulate brain development, they are what we call endocrine disruptors, they act like a hormone, and they act on hormone receptors. In animals, high doses change spontaneous behavior. And they change also these proteins that we hear about when we are worried about the brain, including synaptophysin, and they've been shown to interfere with brain development in animals. So what the Danish cohort allowed us to do is come from these 100,000 women up here down to selecting autistic children from among autistic children. At the time when we did this, we only had 301 diagnosed. Now we have 460. We selected 220 out of those, and then also a control group of children who were unaffected, and went back to the serum samples. And then analyzed them for all of these agents. We sampled only 220 because we were, first of all, also interested in ADHD, attention deficit, as well as cerebral palsy. And we only had a limited amount of money, so we couldn't analyze the serum from all of these kids. That's why we sampled. Well, the news is good for autism. This is our magic one, no effect, and you can see that the PFOSs and the PFOAs that I just showed you have no relationship to autism diagnosis. This one starts to worry me, hexasulfuric, but then it drops in the highest exposure quartile, it drops down. So this may just be random fluctuation. That's what we think at this point. So we're not worried about these agents causing autism. The news is not so good for cerebral palsy. Okay? So when we talk about different diagnoses, we have to keep in mind we are always autism focused, but there are many ways of harming an infant brain. So this is hot off the, not even off the press, my student just generated that for me, and his paper on cerebral palsy is currently in review, and there we actually see a twofold risk increase, which is rather large, and we have very little we know about cerebral palsy risk factors in general, which also tells us we have to sometimes look a little bit broader and not just be focused on one diagnosis. And that's pretty much all I wanted to say, except for thanking my collaborators. This is my student Tracy and Sian, who generated some of the wonderful environmental data. Jasveer, who is a postdoc, she's working closely with Dr. Olson on all of the prenatal related issues. And of course for the funders, and all of my colleagues who work with me on air pollution.
You mentioned that you didn't have the data back for pesticides and autism, but you did for cancer and Parkinson's. And can you just tell us briefly, yes, no, there's a correlation?
Yes. When we talk about pesticides, there are 640 of them, active ingredients that have been used over the last 40 years in California. And the word pesticide is probably wrong. You need to look at very specific agents, which we can because we have the data in California. And yes, we found quite a few pesticides that actually are related to Parkinson's. And a lot of that story is a gene environment story. So we needed to look at susceptible subgroups who could not detoxify certain pesticides as efficiently as their neighbors. And that's what my study that is now going for 15 years actually. We started in 2000, almost 15 years. We have been teasing out a lot of very nice gene-environment interactions showing, yeah, when you have this specific genetic susceptibility, you're not fast enough in detoxifying this specific agent, that's when your risk increases fourfold or fivefold or sixfold. We are just right today coming out with a paper on that actually, where I've been interviewed on that kind of gene-environment interaction. For the childhood cancers, we are still in the process of analyzing it, but it looks like, again, childhood cancers are very many different cancers. And here we are not talking about neurodevelopmental agents, we are talking about carcinogens. And among those pesticides are some known carcinogens, right? At least in animals. And of course, it's always a dose matter. And are we getting exposed at the dose that would make us worry that it's really a sufficient exposure? And so we're looking just at the list of carcinogenic pesticides, and we do see something coming up for leukemias and brain tumors. But those results are still very preliminary. And so for the autism, we will be going back to neurotoxins and neurodevelopmental agents.
All these things have been going down.
Exactly.
So I'm wondering what you think about what might be going up and causing this. That's,
yeah. No, I completely understand. And that's actually, I think, a paradox in reproductive epidemiology that we need to start to wrap our mind around. And it's a paradox only because fetal development can go wrong in so many different ways. And when it goes really wrong, when we have really high exposures, what happens? We lose the baby early. And humans actually lose a lot of fetuses, and they lose them very early in pregnancy. So you could actually argue that if you are highly enough exposed, you will lose that fetus if that fetus was vulnerable to being harmed. And if that fetus would otherwise have developed one of these disorders, that fetus is not going to develop it because it's not going to be born. And we all know that there's this paradoxical result where actually active smoking is really bad for the fetus. We all agree. And there's a high spontaneous abortion rate among women who actively smoke. And there's a high fetal mortality rate among women who are smokers and whose babies are brought to term as well. However, interestingly, smokers' babies born, their overall mortality rate is lower than those of non-smokers. And that was seen as the paradox. How can it be that, fetuses or children from smoking mothers then do better on the mortality right after birth? Well, we now have bias analysis, we call it, where we can actually go back and see how much fetal loss there must have been. And you can perfectly match the loss to what happens later, meaning that the ones who survive were the hardy ones. So they actually then have a lower mortality rate than the ones that got lost. All the susceptible, sensible ones were actually lost during pregnancy. So part of what we might be seeing is a shift from actual loss of fetuses to them surviving and then later being diagnosed with some of these developmental disorders. And that might be part of that wave coming through at this point.
Has there been any look at pollution rates across the world?
You really need to define what pollution is. And as I just said, we could do this in China and we might not see anything. And my guess would be the air pollution is so bad, indoor as well as outdoor, that I would bet on fetal loss rather than seeing these children survive, right?